Hey guys, welcome back to the channel. It's David here, and if you've recently joined our channel, you would know that I've been diagnosed with cancer recently, cancer at the base of my tongue, and I have decided just to share my cancer journey here on the channel. And if you do want to check out that first video I posted, I'll just link that somewhere above here for you if you want to check it out. In the last video I shared, Alicia and I went to the hospital together. We got the results of the biopsy, and it was also confirmed that I do have stage 3 cancer. A lot has happened since then, and I've been very busy visiting the hospital almost every day with multiple appointments each day. So I thought I'd just give you a quick update about all the things that I've been doing, just to keep people posted. And also, if you're someone who's going through this yourself, or maybe you just found out you've got cancer, maybe this might help you. After that last meeting I did meet up with the oncologist, and they basically just talked me through the treatment that I'll be getting, and that will be chemotherapy and also radiation. There is no surgery in my case. They are just going to do the radiation and chemo, which I was quite happy about because it just means there's no surgery, and hopefully I retain all my speech and I don't have any issues eating and swallowing. So that was, I guess, a positive. The oncologist also talked about the chemotherapy and gave me, I guess, a choice if I wanted to have 6 cycles or 3 cycles. They did suggest that I do have 3 cycles of chemotherapy. It does mean I'll be getting a stronger dose each time, but they do think that because I'm relatively young and healthy, that my body should be able to cope with it. So the oncologist organised quite a few things to happen for me over the next week. The first thing was to get a PET scan, and this was just another scan to confirm my diagnosis, and I guess also to make sure there's no other cancer in my body anywhere. If something else was found in other parts of my body, it would have probably meant I was stage 4 cancer. The good news is nothing else was found. They did find a nodule in my lung, but they said it's unrelated. There was no uptake during the scan, so they're saying it's not cancerous. But I guess it's something they'll monitor through my treatment. The next thing that happened was I met with the doctors in the radiation department, and the doctor there was very thorough. She took me through all the potential side effects. There's a lot. She must have been going on for about 20 minutes about all the different things that could possibly happen to me. It really didn't faze me. I'm not really too worried. There's a lot of bad things that can happen, but she did say a lot of the things don't usually happen. So I guess they just have to cover all bases and just let me know that they're the possibilities. I also spent some time getting extra scans done, and they fitted a mask. Basically, it just goes over my face, and they put all these different markers on it, and they put me through I think it's the CT scanner again, and that basically just tells me exactly where the cancer is, and when I get my radiation therapy, they know exactly where to scan or where to focus the radiation. There was a little bit of little episode I had. I was getting the catheter put into my hand, and I don't know what happened, but when the nurse injected the saline solution, I just got really dizzy, and I just felt really weird, and I basically just said to her, look, I feel weird, can you get a doctor? I don't know what's going on. And I just kept getting lightheaded and just felt like I don't know, it was cold or hot. I couldn't really tell. It was just like something was going throughout my body. And they took my blood pressure again. It was down to like 70/38, which is extremely low. A normal blood pressure is 120/80. So yeah, that's never happened to me before. Basically, they lied me down on the bed, put my feet up, and I came good in a few minutes, but it was pretty scary. This was before I had that CT scan done. They had to put the catheter in so that they could inject the contrast dye for when they do the second scan. So it was a little bit scary, but obviously I've got through it okay. Another thing was I've had hearing tests done. I mentioned in the previous video that I had a dental checkup just to get, I guess, a baseline of where my teeth are at and just to make sure they're healthy. And they've also done the same thing for my hearing. Apparently with the chemotherapy drugs that I'll be getting, it could affect my hearing. So they want to continue to test me just before each cycle of chemo. I will be getting the 3 cycles of chemo, so I've had 1 checkup now, so I guess I'll have 3 more hearing tests as I go along. At the moment my hearing, they said, is very good. They did say I had a lot of wax in my ears, and the doctor actually sucked it all out basically, so he had like this thing that just sucked all the wax together, and then he used some tweezers and pulled out, and it was just like this little nugget of wax in both ears. It was pretty gross. But yeah, good news is my ears are good at the moment. Hopefully the chemotherapy doesn't affect my hearing too much. I'll guess we'll find out when that happens. Another thing that happened was an MRSA test. It was just basically a swab in my nose. I don't really know what they're testing for. Perhaps I can put some information on the screen now about what that test reveals. I also found out that I'm going to be part of a clinical trial. It was totally optional. I didn't have to do it, but the doctors did ask if I wanted to be part of a clinical trial for my particular cancer. So it doesn't change my treatment at all. Basically, they're just going to take some blood. They've already taken blood from me, and they'll do another, I guess, test after my treatment. So I think there's just some markers that they check for, and that'll be part of the trial. So that's pretty cool. Hopefully, that helps other people out with that trial. And tomorrow, I've actually got surgery. Tomorrow I'm getting what's called a PEG put in. That's basically just going to be a feeding tube that goes directly to my stomach, and they do believe that as I get radiation therapy that I might not be able to swallow at some point. So they want to have that feeding tube in there ready to go. There are some people that maybe don't get the feeding tube, and then they have trouble and they lose a lot of weight, and it's very detrimental to their treatment. So yeah, I'm actually quite happy that I'm getting that feeding tube straight away. So I should be able to get all the calories that I need no matter what. They have said that I need to try to keep eating as much as I can for as long as I can, because the muscles, for swallowing, if I don't use them, they'll become weaker and maybe stiffen, and I guess I'll have a hard time returning to eating normal after I finish my treatment once I get through it. So yeah, tomorrow I've got that surgery. So I start my chemotherapy and radiation in 4 days. I expect the chemotherapy is going to affect me from the get-go, but I'm told the radiation won't really affect me for a couple of weeks. So yeah, we'll see how all that goes. I'm going to keep sharing updates, and I'll let you know how I'm going. I do appreciate all your support. Thank you so much for watching this video. If you haven't yet, please subscribe, and I hope to see you on the next video. All right, thanks everyone. Bye.